Mr. Schultz, I want to follow up on an issue that you raised when you held up the bottle that had the prescription drug information insert for providers and pharmacists attached to it. As you mentioned, the FDA is considering issuing a proposed rule that would require just electronic information for prescription drugs products in lieu of these paper inserts, including the one that you just demonstrated. As the chairman's well aware, when I was the chairman of the Homeland Security Committee and we did an in-depth investigation into Hurricane Katrina, and we learned during the course of that investigation that there are times when electronic technologies are simply not available, whether it's due to temporary power outages or a catastrophic natural disaster or terrorist attack. In addition, as a representative of a largely rural state, I know of many patients and healthcare providers that still reside in areas that have limited access to the internet. As a practicing pharmacist, do you think that such a switch from paper to only electronic information would be in the best interest of healthcare providers and their patients?
Thank you for that question. Certainly this is an area that is I'm very passionate about because of the need to have this information available and have it readily available. You brought up several important factors, and that is when the internet is not available, and there would be a question about the information that is in this packet and how it affects that practitioner's decision as to how they dispense or whether they dispense or what directions they give the patient regarding this information. That is clearly problematic in natural disasters. It's clearly problematic in areas, rural areas where there is difficult internet reception. Also, it's difficult for Department of Defense pharmacists and healthcare professionals when they're in a forward operating base that does not have that type of internet, or they're not able to use the internet based upon some security issues. So there are a number of different practice settings that this information would be totally unavailable to those practitioners at that time. So that's incredibly important. Then you go the next step, which is the fact that if you look, and unfortunately there's a lot, oftentimes is that when we look at healthcare policy, it's inside the Beltway thought processes. And sometimes we have to go out and think of what happens on the front line and outside the Beltway. If you're a practicing pharmacist and you're working really diligently to fill 400 or 500 prescriptions, sometimes 800 prescriptions a day, your focus is right medication, right patient, right directions. If something comes up as to a conflict or a question or a dosage that you need to make an interpretation based upon the fact that your patient has impaired renal function and this is metabolized through the kidneys, those kinds of issues, that information is here. It's always been here. It's been a lifeline for pharmacists. In the GAO, in the 2006, when the FDA actually passed a rule as to justify the financial significance of the rule, they cited the fact that to increase the information that's in this insert, increase the formatting, is that would have significant effect on adverse drug events and hospitalizations. We don't disagree with that. I think they were exactly right, and this information needs to be very robust and needs to be available. Now, when you look at in a normal pharmacy with a high volume, they may have internet connectivity in their region, but from a workflow standpoint, they're not out surfing the internet for this information. And there's been no study, to my knowledge, that has ever determined. And again, if I go back to GAO and I go back to the 2006 FDA economic significant analysis for expanding this professional insert, is what we have is 12 12 times per every 1,000 prescriptions, this is access for information by the pharmacist. That is a significant amount of inquiries into this information that wouldn't be available. You can't stop your workflow and go out and search the Internet to go get this, because that Internet, and these are closed systems, they're closed operating systems, and they don't actually go out and surf the Internet because of obvious HIPAA reasons, all the kinds of hacking reasons that would go on. So having this information readily available so I can turn around, pick this up off the shelf, and have this information is absolutely critical.